Hey, if you're dealing with peripheral neuropathy, please, it's important you take the next few minutes to hear what I have to share. Hi, I'm Dr. Alfred Giganti. I'm a chiropractic physician here in New Jersey. I'm the author of Hope and Help for Back Pain. I founded Joint and Spine back in 1995, and I've been treating patients for over 40 years. And I can't tell you how frustrating it is to see so many patients in my past that I was not able to help, particularly with peripheral neuropathy. The good news is, once we incorporated magnetic healing pulse therapy, this relatively new therapy here in America, patient outcomes were better and faster than ever. And not just clinical outcomes, but tangible outcomes experienced by the patient. So what is peripheral neuropathy? Peripheral neuropathy is due to nerve damage, mostly experienced in the hands and feet. The nerve damage can come from nerve impingement in the spine, blood sugar disorders, alcohol, side effects of other medications, and idiopathic causes that we just don't know why. Treatment for peripheral neuropathy is primarily incorporating magnetic healing pulse therapy. So what exactly is pulse therapy? Well, although relatively new here in the United States, pulse therapy actually started with the work of Tesla many years ago. This painless, non-invasive therapy has been used in Europe for decades. Magnetic healing pulse therapy has two key functions. One, it causes a form of cellular exercise, which helps eliminate toxins in the cell. And two, key, it restores the normal electrical charge in the cell, especially nerve cells, which is essential for healing to begin for peripheral neuropathy patients. In fact, cells in your body work much like your cell phone. No charge, no function. The difference is where a cell phone can function relatively normal with 10% charge, your cells in your body cannot. And as the charge in your cells drops, the cell stops functioning normally. This will produce a host of symptoms from pain, swelling, numbness, tingling, burning, to a complete loss of all function. As I stated before, pulse therapy not only increases the electrical charge in each cell, which is essential for healing to begin, but will help rid toxins in each cell. The bottom line, if you're dealing with peripheral neuropathy, regardless of the severity, please take advantage of the offer below. We have nothing to lose, and doing nothing with peripheral neuropathy will, without exception, get worse. And let me be perfectly clear with you there are no quick fixes and no guarantees. The good and bad news is there is a pre-magnetic healing pulse therapy screening that allows me to determine prior to starting if your condition is too advanced to get help from pulse therapy. I offer the screening at no charge and also a 30-minute session so you, the patient, can experience what pulse therapy actually feels like. This is normally a $95 charge. By the way, you'll be giving a Pulse Fuel. That's a liquid multivitamin mineral detox and joint compound. This is normally $65. And let's face it, peripheral neuropathy is challenging, and without your willingness to be consistent with care, peripheral neuropathy will get worse. A side note, and in my professional opinion, beware of these large one-time fee for care. I believe care needs to be step-by-step journey with you and your doctor, where slow, steady improvement is seen tangibly by you. So please call for no charge screening and your half-hour session. You got nothing to lose. Remember, what's treatable today may not be treatable tomorrow.